Hello Medicose. This video will break down the science behind cardiac action potentials, the electrical signals that control your heart's rhythm. We'll explain the 5 phases of the heart's electrical cycle and dive into the role of the SA node, the heart's natural pacemaker. By the end, you'll understand how these tiny electrical impulses keep your heart pumping day and night. Stick around to uncover the secret behind every heartbeat. Let's start by understanding cardiac action potentials, the electrical impulses that regulate your heartbeat. Action potentials are changes in the electrical charge across cell membranes. In the heart, they control how muscles contract and relax. The resting membrane potential is the baseline charge, typically minus 90 millivolts MV, in the ventricle's atria and Purkinje fibers, and it's determined by potassium ions, K+. Now what drives the heart's electrical activity? The answer lies in different ions, mainly sodium, Na+, potassium, K+, and calcium, Ca+. These ions flow in and out of the cell, creating electrical currents that generate action potentials. The Na+/K+AT pace pump helps maintain these gradients. Now let's break down the phases of a cardiac action potential, especially in the ventricle's atria and Purkinje fibers, where these signals are long-lasting. There are 5 key phases. Phase 0, upstroke. This is where the action begins. An increase in Na+ conductance leads to a rapid inward current of sodium ions, depolarizing the membrane and causing an upstroke in the action potential. Phase 1, initial repolarization. A brief outward flow of potassium ions causes initial repolarization, but it's short-lived. Phase 2, plateau. Here's where things get interesting. The membrane potential stabilizes, thanks to the balance between Ca+ flowing in and K+ moving out, leading to a plateau phase, which is crucial for muscle contraction. Phase 3, repolarization. As calcium flow decreases and potassium flow increases, the membrane repolarizes, bringing the potential back down. Phase 4, resting potential. Finally, we return to the resting state where inward and outward currents are balanced, with the membrane potential once again approaching the K+ equilibrium. Now, let's talk about the SA node, the heart's natural pacemaker. It has a unique feature called automaticity, meaning it can generate electrical impulses without any external trigger. The SA node's resting potential is unstable and it depolarizes spontaneously, giving rise to a heartbeat. Unlike other parts of the heart, the SA node's upstroke is driven by Ca+ conductance instead of sodium. This inward flow of calcium causes depolarization. Phase 3, repolarization. The repolarization phase occurs when potassium conductance increases, causing potassium to flow out of the cell, resetting the membrane potential. Phase 4, spontaneous depolarization. This phase is crucial for the SA node's pacemaker activity. It's caused by a slow, inward sodium current called IF, which gradually depolarizes the membrane until the next action potential is triggered. An interesting fact, the SA node isn't the only part of the heart that can generate action potentials. The AV node and Purkinje system can also do this, but at a much slower rate. In fact, the SA node has the fastest intrinsic rate of depolarization, making it the dominant pacemaker. So to summarize, cardiac action potentials drive your heartbeat by controlling the movement of ions across cell membranes. The SA node is the heart's natural pacemaker, controlling your heart rate with its spontaneous depolarization. Understanding the different phases of action potential is key to knowing how your heart functions.